Hey there, School of Speechers. It's Carolyn Dolby, your host of School of Speech. May being National Speech, Language, and Hearing Awareness Month, School of Speech is turning up the volume on a powerful conversation worth repeating. It's titled Promoting Hearing Aid Use and Self-Advocacy in Children Who Are Hard of Hearing. Our guest, Meaghan Foody, dives into the hard of hearing, the impact of hearing aid use, and the importance of self-advocacy. This episode is your reminder that supporting students goes way beyond access. It's about empowerment. Let's amplify strategies that make a difference and champion every child's right to be heard. Hey, added bonus, each episode of School of Speech is offered for 0.1 ASHA CEUs. Keep on listening. Welcome to the School of Speech podcast, presented by SpeechTherapyPD.com. School of Speech is designed specifically for the school-based SLP to come together to discuss current topics, tackle difficult situations, and share our insights. Our goal is to bolster confidence, celebrate our triumphs, and foster a community dedicated to the excellence in the school setting. Welcome, everybody. I'm Carolyn Dolby. I'm your SpeechTherapyPD.com podcast host for School of Speech. Today's episode, Promoting Hearing Aid Use and Self-Advocacy in Children who are hard of hearing. We have Meaghan Foody today as our guide for our exploration for aural rehabilitation. She's here to discuss key factors that predict hearing aid usage. We're going to gain insight into developing personalized goals, and uncover practical strategies that are going to help our students communicate their needs and also their rights in order to foster independence and self-advocacy skills. Before we get started, we will have to do some housekeeping. Each episode of School of Speech is 60 minutes long, and it is offered for 0.1 ASHA CEUs. I'm going to do our financial disclosures. All right. Meaghan is salaried as a full-time employee at the University of Iowa and the University of Iowa Hospitals and Clinics. And she's receiving an honorarium from SpeechTherapyPD.com for her participation in today's episode. For she has no relevant non-financial disclosures to disclose. For me, I receive a salary as the district level specialized support clinician for my district in Houston. I also am an adjunct professor and teach graduate courses for the University of Houston. I also consult for school districts across the nation, supporting their program development and staff training. And I do receive compensation from SpeechTherapyPD.com for hosting School of Speech. Non-financial, I am a member of the TISHA, which is Texas Speech and Hearing. I'm a part of their Feeding and Swallowing Task Force, which is amazing. I volunteer for Feeding Matters, and I'm also a member of ASTRA Special Interest Groups 13, which is Swallowing, 14 Cultural and Linguistic Diversity, and also 16 School-Based Issues. But enough about me. I want you to know all there is to know about Meaghan. She is a speech-language pathologist at the University of Iowa. And her specialization is in aural rehabilitation across the lifespan. She provides diagnostic and treatment services in both the pediatric and adult populations, primarily for individuals who are deaf and hard of hearing. In the summers, Meaghan co-directs the Communication Explorers program for young children who are deaf, hard of hearing, as well as co-directing the University of Iowa's SHINE program. I love that, for adolescents and teens who are deaf and hard of hearing and who stutter. Okay, wow. Meaghan is passionate about emphasizing collaboration between professional students in their areas of speech language pathology and audiology to maximize patient outcomes, post-cochlear implant and or hearing aid fitting. Welcome, Meaghan. How are you?
I'm so good. Thanks for having me.
Oh, no, we are the lucky ones to have you today. We are so excited. Well, before we get started with all the questions I know we're all going to have to ask, Meaghan, I'm so interested in your journey. How did you become an expert? How did you decide that this is your specialization?
Yeah, I was really lucky. I kind of knew I wanted to be a speech language pathologist from about the time I was in the seventh grade.
Oh, wow.
I had a family member who had a significant language delay,
Mhm.
and watching kind of pre and post his experience with speech and intervention. But even more than that, like watching my family and how all of a sudden his involvement and interaction with other family members just, it was like the doors kind of opened. And that was kind of it. That was really all it took. I was really fortunate. I mean, the simple answer to your question about like, how is mentorship? I've been so incredibly lucky with the people that I've encountered throughout my education and stages of my career. I went to Purdue for my undergrad, so a little different here at the University of Iowa. That's a tricky situation. But I, again, kind of knew that I wanted speech therapy. And then I took aural rehabilitation with Dr. David Ertmer, who has since retired, but was such an impactful mentor for me. And any time that we talked about like the technology, I was like 2 times more engrossed in
Mm.
class. But I never really saw myself going the audiology track. I always thought it was speech. I was fortunate to volunteer at a school for the deaf when I was an undergrad, and that really sealed the deal. And then I kind of sought out graduate programs that would give me additional opportunities to really work with this population that I found myself so passionate about. So I made a huge leap and I moved to Utah. I went to Utah State for my master's. I'd never seen a mountain before. I thought skiing just happened in Michigan. It's very different there. And Dr. Christina Blazer, who's now at the University of Idaho, was at Utah State at the time. And she has just had such a profound impact on my career and my passion for this field. So that kind of sealed the deal. Utah State had a preschool program for kids who are deaf and hard of hearing on campus, where we got to work really closely with the kids and even more kind of impactfully sometimes. Got to work really closely with deaf educators as well as audiologists, both professionals as well as graduate students. And yeah, that collaborative piece has always been something that has really made me fall in love with and continue to love this field. After graduation, I knew I wanted to do a clinical fellowship that would really maximize my experience working with people who are deaf and hard of hearing, and got incredibly lucky and wound up at Boys Town National Research Hospital in Omaha. Yeah, it was the best. Again, just like incredible opportunity after
Mhm.
incredible opportunity. I, again, have just been so fortunate. And that particular experience was really awesome, for lack of a less cheesy
Mhm.
word, because I was 60% clinic and 40% research as a clinical fellow. So I was in Boys Town also as a preschool program for kids who are deaf and hard of hearing, and then also saw patients in our outpatient clinic with the cochlear implant team kind of across the age range. And then again, 40% of that I was on the OSACH grant, or the outcomes of school age children who are hard of hearing, and got to work with professionals at Boys Town, the University of Iowa, and the University of North Carolina. Is the largest longitudinal study of its kind for kids who are
Mm.
deaf and hard of hearing. Got to work with Dr. Mary Pat Moeller, who's been profoundly impactful in child language development with kids who are deaf and hard of hearing. Bruce Tomlin, Ryan McCreary, Beth Walker, who's at Iowa now, and just had so much mentorship there, both on a research level as well as on a clinical level. There was such an openness in terms of communication modality at Boys
Mm.
Town, where all communication modalities were accepted and celebrated and fostered and encouraged. And I think that a lot of the time we kind of have this idea of you have to fall on the aural side or the sign side of
Yeah.
communication. and being able to really explore that continuum with families and the kids themselves was just profoundly rewarding. Like most things in life, there's no right way to do one thing. And watching kids really flourish with multiple communication modalities was just one of the greatest blessings of my career and of my life as a whole. I left Boys Town kind of mid-pandemic. My sister had my first nephew back in Chicago. It just felt like time to move home. And then I got an email from Dr. Elizabeth Walker, who's here at the University of Iowa, that this clinical faculty position was opening in aural rehabilitation and would I be interested in applying. And really was like, okay, made a big personal decision here, but professionally, this just feels like something I can't turn down. And I'm just so lucky to work here and to have had the opportunities I've been given to collaborate with research and clinical work, audiologists, school-based professionals, and students now, getting to watch students develop their own skills, their confidence, and get to collaborate with other graduate student clinicians on the audiology side. It's every day has some kind of positive highlight. And
Mhm.
I think that as a whole, we're so lucky as speech language pathologists that we have careers that are so fulfilling, where each day you can kind of pull out some kind of positive note about what happened. And the University of Iowa has given me so many of those. So that's kind of where I'm at.
I love your passion. I mean, it is palpable. It just is amazing. I've been looking forward to this episode. Like I was talking with you a little bit before about kind of my journey too, and my nephew is deaf in 1 year, and his journey with that. And I meant to say my stepfather recently got a cochlear
Mm,
implant late in life, right? So
yeah,
I mean, it's very part of my world. And what I love about my district is we are the regional day school for the Northwest Harris County Co-op for the deaf and hard of hearing. So it's I just love it. I love the experience that I've gained. Love it so much. But all right, okay, just we're all so passionate and I just love it. But let's get into let's start. Where should we
sure.
start? Maybe going into like those predictors. I think maybe that might help us get started. What are those predictors that we need to be looking out for or maybe encourage
Sure.
to for the usage of devices?
Yeah. So recent research studies, again, I work really closely with Dr. Elizabeth Walker, and she's done some research to look at what outcomes look like and kind of what those primary factors or considerations are that we need to be aware of. And I think one of the things that we need to consider is as speech language pathologists, there are going to be factors that are completely outside of our control, right? So degree of hearing loss, socioeconomic status of that child, maternal education is a big one. And obviously
Okay.
those aren't things we can control. So I won't talk as much about those, but I want to think more about kind of the qualitative factors that we can consider. So one of the big things that leads to more optimal device use, which in turn often leads to better language outcomes, better academic success, better social relationships between their peers, is how well they understand their devices, right? It's one of those things where when you think about kind of early elementary, nobody wants to be different, right? No one wants anything to stick
Yeah.
out. Anytime somebody asks, like, oh, what is that in reference to a hearing aid? For a lot of kids, their reaction is, oh no, they're asking because they want to make fun of me or it's
Oh.
different. But when we give them the verbiage and the language to say, it's my hearing aid and it helps me hear, as simple as that is, at that stage of the game, for most kids, that's enough. And they're like, okay, and kind of walk away from it. But
Mhm.
giving them that verbiage, I think, is something that starts really early on. It sounds kind of crazy, but autonomy, in my opinion, starts with early intervention. So
Mhm.
talking to parents about, appropriate vernacular and vocabulary, I think is really important because if we give kids appropriate terminology, they know the different parts of their devices, they know how to explain what they do, they can troubleshoot them at a very basic level. Of course, we don't want them changing anything about their hearing aids,
Right.
but giving them the ability to be autonomous helps them have a better connection to that device, and in turn is going to make them more likely to use that device. The other thing too that we want to think about is, do they know the why? So there have been kids that I've worked with in the past where they ask questions like, when am I going to graduate from having to wear my hearing aids?
Sure.
And that's a heartbreaking question, right? Because a lot of the time they're asking that question because they don't want to wear it anymore. And that could be for a multitude of factors, but a lot of it is kind of social emotional in nature, from my experience anyway. But if they really understand the importance of the device, the longevity of their need for that device, and why it's important for them, we're all more likely to do things when we know the why behind it. And that's true for kids too. So, kind of being able to help instill some of that autonomy, knowing those indicators whenever possible. Of course, we don't know the ins and outs of every child and kind of what their home life looks like and what those more external factors are. But if we can help them develop a positive relationship with their device, which is where I think we can really come into play as speech language pathologists, I think that that makes a pretty profound impact on them, years down the line, even into adulthood, which is pretty powerful to think about.
Yeah, absolutely. I like the things that you've said that have really hit home is make and I think part of speech pathology is making relationships.
Mhm,
And there was a huge, right, psychosocial, you brought that up. And and it just made me think about diversity
mhm,
and really honoring diversity. And it's kind of what you're saying is giving the words for them to use it. Yes, it might look different, but this helps me. That was so powerful and gives them. I think sometimes when you don't know what to say, then you wanna shy away from it, but giving
mhm.
them those words that, well, "This is me. This is
Yeah,
me," is powerful.
yeah.
And I think it is important to know about, outside of school, their relationships outside of school, and getting that bigger picture for students, like, in this population for sure.
Mhm,
Yeah. But I guess maybe we're kind of getting into, like, okay, so we're first thing, start at the very beginning, giving them the words to use to discuss of the what it is and why. I think you're right. If we don't know why we have to do something, we're not gonna do it.
mhm.
It's, "Oh, well, that's great. It's cute, it's pink." But right?
And
But if you
honestly, that stuff, like, it seems so trivial, I think, on the surface level of, the different colored ear molds
yeah.
and different processor colors and all of these things, but those are big, especially when
Mhm.
they get to make a decision about what it looks like. The thing I always go back to that, like, I can pull from a personal experience is I was a 90s kid, so I
Mhm.
had this pair of like blue shiny Skechers that were horrible. They were
Ah.
hideous, but I loved them. And I wore them into the ground and my mom was like, "We need new shoes. We got to get new shoes." And I just wouldn't, and I didn't want to do it. And as a mom, which I've learned to let go of, she threw them away one day when I was at school. But I think the reason I remember those is because they were mine. Like, it's one
Mhm.
of the first things that I got to pick. And again, when you give them the power and the control to say, I want pink sparkles, I want blue and red because I love Spider-Man, like, that is the stuff that makes a big difference because they can tailor it to themselves. And again, on the surface, it looks kind of small, and how much of an impact is that really going to have? But it does help foster that sense of autonomy and kind of ownership over their devices, which is huge because a lot of the time, Parents are scared to let them change the batteries or do any kind of troubleshooting because they're small, they're fragile, they're expensive.
Mhm.
But the more ownership they feel, the more apt they are to want to use them and to feel connected to their devices.
I think you hit it, that they need to know it's theirs.
Hmm.
This isn't being done to them.
Yeah,
No,
yeah.
and most I think as children, so many things are just told to them or done to
Hmm.
them. And no, you're like, "No, this is yours, and
Hmm.
we are here. We are your customer service
Yeah,
providers,
yeah,
basically. We're here to help you with this and what
yeah,
you need because it's yours."
sure.
You're
Yeah,
right, and I think we do take care of things when when they're ours versus, I mean, as children,
yeah,
if you think of
yeah,
it that way.
yeah.
Yeah, yeah,
They still get lost, they still end up in places they shouldn't, but the goal, of
right.
course, is just that kind of connection. And the same thing with, I think, as like a society in general, there's been this push toward representation. And so,
Sure.
like,
Mhm.
finding books that you can incorporate into treatment sessions that feature kids who are deaf and hard of hearing, that have hearing aids or cochlear implants. There's quite a few available. Seeing things like in the most recent Toy Story movie, just in like the background, there's a kid with a cochlear implant. And he's not a character, he's just a background character. But again, just getting to see kids that share this common feature that they have in media, whether it's books or shows or whatever it is, like that makes a big difference for kids.
Oh, I agree, and especially for, I know the difference in my district, there we have that community, but
Hmm.
I'm thinking about those that are listening that don't have that built-in community of, like, the regional day school that we have, and finding ways to build that community for them, and I love literature and bringing that in, and when you said that, yeah, we do lack representation, and finding books that are respectful and represent is, it's hard, but we need to do it. Thanks for letting us know about Toy Story. I think we're gonna
Yeah.
all Google that and try to get that clip because I think
Yeah.
that's powerful.
Yeah.
We we're not islands, you're not alone. This isn't,
Mhm.
yeah, I think that's important for them to see that they're okay,
Yeah.
you know?
Yeah.
Yeah. Talk about, yeah, building just autonomy. I love it. I guess when we're looking at, we're those that are listening, we're school-based clinicians.
Mhm.
So when we're looking at maybe talking about formulating goals, because that, we're a goal-based society here in the schools, and
Yeah.
and we can't have 15 million goals, but I do think you're saying that, we do need to make sure that we have a goal in self-advocacy. Is that what I'm hearing?
Yeah,
Yeah.
absolutely. And I know, like, being in primarily outpatient settings, there's so much more kind of flexibility and adaptability that can come with goal development. So I want to make sure that I recognize that there's going to be variation from school district to school district. But even if it's something you work on informally and just kind of have counseling based conversations, you can start these goals really early. For some of my young kids, it's just about, do they replace the ear hook if their hearing aid kind of flops and is wobbling on their ear? Can they do that? Or do they tell an adult that they need help? That's a big one because, of course, again, devices are expensive. Little humans can be hard to predict. We don't
Mhm.
want to lose devices. And so if they know to ask for help, that's big. As we move kind of into the school age population, like, can they remove their hearing aid appropriately? So, coming down to where the ear mold is versus pulling by the tubing, which could crack the tubing. Can they insert it by themselves or reposition it? Because again, that's all autonomy. And then we have to think about like peer-to-peer correspondence and interaction. And this is totally true across the lifespan. I have this conversation with like first graders, and I have this conversation with 90-year-olds. When we don't hear something, our tendency is to say what or huh. And in turn, that person is probably going to say the exact same thing in the exact same way at the exact same rate at the exact same volume, looking in the same orientation they were looking before. But if we can help kids understand the why behind a communication breakdown, or maybe why they weren't successful in hearing what was said by a peer, an adult, whoever the situation might be, then they can advocate for themselves in a really specific way. So, can you say that again more slowly? I wear hearing aids. Sometimes that helps me. Can you look at me and say that again? I couldn't really understand you when you were facing the opposite direction. And we're all guilty of it. We all talk to each other while we're in the next room, or we're trying to find something in our bag, but we're still having a conversation. And again, when you can ask for really specific things, it helps you as the listener be more successful. But what I really like about it is it also kind of puts the onus on a communication partner. A lot of the times people who are deaf and hard of hearing, they feel like a burden because they have to ask for repetition multiple times. And they're like, well, I don't want to do that. That's annoying. My brother doesn't like it when I do that, so I don't want to do it to my friends. But when you give them something to change, now all of a sudden you're sharing the responsibility of making that a successful exchange, which is so powerful regardless of how old you are. SLPs, as audiologists, we see it as such like an obvious thing, right? Advocate for yourself. Communication is important. But people get impatient. Again, no one wants to feel like a burden on anybody else, but the more specific they can be in repairing those communication breakdowns, the more likely they are to successfully facilitate that. Another piece of self-advocacy and things we can work on is, do they know the basics of their device? Can they label the different components of their hearing aid? Do they know what the indicator light means? If they use a remote mic of any kind or any kind of hearing assistive technology, do they know the basics about how to set that up? Do they know what it sounds like when the teacher has the microphone on versus off?
Hmm.
Because again, the more that they can really understand the technology, the more likely and more quickly they can become the expert on it, so that, as they get older and have maybe less supports in place, they can advocate for themselves appropriately. Newborn hearing screenings have been so beneficial. And, before newborn hearing screenings were required, we were really late in identifying lots of kids who were deaf and hard of hearing, especially in that kind of mild to moderate, even mild to
Mhm.
severe population. But because of newborn hearing screenings, they're getting fit sooner, they're getting services sooner. Follow up is happening appropriately because families have appropriate guidance. And in turn, they're ending up in mainstream classrooms and mainstream environments, which is awesome because it means that they're developing relatively similar to their same age, typically developing peers. But it also means that they might end up in a classroom with a teacher who's never worked with any kind of hearing assistive technology
Right.
before. And that's difficult because, as teachers, of course, the child's best interest is always at hand. But when they don't have the background, it makes it really hard to fulfill the need at 100% capacity anyway. But if the child has the ability to say, like, oh, you forgot to unmute your microphone, or give them a little wave, or whatever kind of system they want to work out, like, now all of a sudden everybody's more successful. So there's pros, of course, to kids ending up in mainstream environments when they use spoken communication in particular, but there's also challenges. And again, the better we equip the kids to be able to advocate for themselves, the more successful, hopefully, of course, they'll be when they get into those situations.
I think the word for this episode is why.
Yeah. Yeah.
First of all, like you started with why to begin with, why do you need this device? Then why is it important for you to be able to explain how the device works? Because
Hmm.
then you can ask for help when you need it. And then I think where you're taking us now is the why it's important for educators also to know
Yeah.
their part.
Yeah, it's hard. New technology is scary.
Of course it is.
I
Yeah.
mean, I have no envy for a teacher of a 28, 3rd grade
Mhm.
classroom. That's a lot to manage and a small piece of technology. I think we have this idea of like, oh, it's not that hard, but it is that hard when you're managing everything else going on in that classroom. It's tough. And so we all need support wherever we can get it as providers, as well as children receiving services.
I think it comes down to, as speech pathologists in the schools, that counseling component that we do. You indicated, doing the counseling with the student and the family, absolutely. But I think also you're showing us the importance of the counseling with the educator, with the teacher.
Mm.
And they need to know why. Because I mean, I think all of us are, with Asha doing the, diversity, equity, and inclusion, we're, you know, everybody has needs a voice. Everybody has the right. And I think
And we're all learning, it's okay to make mistakes. It's okay. I can't tell you how many times I've had a child's cochlear implants in my hand and then asked them a question. And I'm
oh,
like, oh, they can't hear you. We all do things, but it's important to just kind of own it, to be able to articulate what we don't know so that we can fill in those gaps and to give each other the space to be able to be honest, right?
mhm,
You can't come off as if a teacher comes to you and is like, hey, I got to be honest, we didn't use the hearing assistive technology today because I kind of forgot how to set it up. If you approach that in a brazen, like, I can't believe that you did that kind of way, we just talked about it last week, they're never going to come to you again.
absolutely.
But if
No
you take the
shaming.
yeah, if you take the time to walk them through it one more time, you encourage them to come to you with questions, everybody's going to be more successful. And the hard part is SLPs, and one of the things that makes me so passionate about like the graduate level with education is research studies have shown that SLPs are seen as the expert on
Mhm,
hearing assistive technology, because even educational audiologists, if they're there in that school, they're probably not there every day. And so
mhm,
if a breakdown happens, oftentimes the classroom teacher goes to the SLP, but research has shown historically that lots of SLPs have discomfort with that.
we
And
do.
again, that's a problem, of course, when the expert in the school doesn't have the comfort level to do some essential troubleshooting. And again, that's not passing judgment on anyone. It's just really highlighting the importance of making sure that we support each other in our understanding in whatever way that can be. And a big part of that is continuing ed sometimes, finding colleagues who can help support you. Those are the things that make us all better, because at the end of the day, this field changes every hour,
Oh,
it feels like. And there's always something new to learn and develop, and that can feel overwhelming, but it's also really exciting.
it is. And I think when you were talking about the journey of how you got here, the first thing you said was your mentorship
Yeah.
and the support that you received. And I think those of us that are listening today, me included, resources in finding mentors, finding, I mean, thank you for those that are listening today. You're coming to get some, some continuing education. This is a great step for that. Any other resources that you can provide us would be great. Anything you can think of that, to help us find a mentor, find continuing ed.
Yeah, I mean, there are, we have like the AR little niche of our field is, it feels like this like teeny little bubble sometimes.
Uh-huh.
We're always in like one corner of the ASHA convention. We like
Right.
stay in the same like 6 rooms the entire time that we're there. And I think for me, those experiences can be so intimidating to walk up to someone and just be able to say like, hey, I have a, kid who's bimodal. He wears one hearing aid and one cochlear implant, and I've never worked with anybody like that before. Like, can you help support me? The other thing to think about and look into is whether or not you can make a connection with the child's audiologist,
Okay.
especially when it comes to the technology piece. They're
Mhm.
going to be a huge resource and still continue to be for me all the time, where I'm kind of noting something and I'm not really sure how to appropriately counsel, especially when it relates to the technology. Because at the end of the day, I'm not an audiologist.
Right.
I'm never going to be an audiologist. I have no intent of getting an additional degree, and it's okay to not know everything. So, in terms of like a day-to-day mentorship opportunity, I would encourage connection with, if you have access to that child's audiologist, and really just connecting with other people within your school district. There's lots of great, websites and resources. All of the different hearing aid manufacturers, cochlear implant manufacturers have extensive resources on their website. And just kind of putting yourself out there, I think sometimes is one of the hardest parts, but also one of the most rewarding pieces that come from it. I think as SLPs, we all really like to talk,
Yes.
and we all like to talk about what we love. So I also think just reaching out, if you ever have the opportunity to, attend a continuing ed talk, or you read a really interesting piece of research, like, I don't think there are too many people who wouldn't be excited to talk to you about it.
Agreed. Agreed.
Yeah,
One of our listeners, Gresser J, thank you. They indicated that go straight to the teacher of the deaf and hard of hearing as a resource. Go straight.
sure.
Yeah, research in your district. Who is that person? That was great. Thank you for sharing that. That's a great resource. I agree.
Teachers of the deaf and hard of hearing are superheroes. I mean,
Yeah.
they do literally everything. They provide instruction for teachers, they provide counseling for students, they do direct instruction with students, they work with families, they work with audiologists. They're usually in like 8 different places at once, it feels like and seems like. Yeah, they're a phenomenal resource that I think is a field we kind of don't highlight them enough because of all that they have to offer, to kind of those collaborative, what's the word I'm looking for?
Mm.
Opportunities? Maybe we'll say opportunities.
I'll go with that. I like
Yeah,
it.
it works.
And I mean, in schools, really, we really are inherently collaborative.
Yeah.
But I think sometimes, I know I do, sometimes I can get so focused on I forget, wait a minute, there are other people. It
Hmm.
isn't just on my shoulders.
Yeah.
I think as speech paths, we take everything on.
Hmm.
And I think if we just go, wait a minute, who else is in our district? Who else do we have out there? And grab those teachers. That's a great idea,
Yeah, it's tough
including
as a
families.
school SLP, like to
It
feel like
is.
sometimes you feel
No
like you're a
joke.
one-man island. I mean,
Mhm.
you're the only one providing that service in the school. It's really difficult to manage schedules and caseloads and try not to pull kids from times teachers don't want you to pull them. I
Yeah.
mean, yeah, it can be really isolating from that perspective. So again, it's important to like take those blinders off and remember like we do have people that we can rely on, whether they're, interprofessional collaboration or just
Mhm.
reaching out to somebody else in a different school district, because it can feel isolating. It doesn't have to, but
But I think if we okay, when you say the word isolating, it makes me think our student is feeling isolated. What would we want for that student? We would
yeah,
want them to have community. We
yeah.
would want them to advocate. And now we're thinking, well, wait a minute. If I'm feeling isolated, I need to be doing what I would do for my student. And I think that's fair.
Hmm.
Absolutely fair.
Yeah.
To
We
be,
talked super briefly. This makes me think about what we call like UI Shine. So that's our
Mhm.
program for kids who are 7 to 17 who are deaf and hard of hearing and then who stutter. And it's an unlikely kind of pairing
I
in terms of
know. Yeah.
population, but it is so powerful to watch them create these, like, you can see the wheels turning of like, wait a second, you and me are different because you're someone who stutters and I wear hearing aids, but you're talking about how you don't like to have to repeat yourself or to ask people to say things again or to have to speak in front of the class because you're nervous about what's going to happen. I feel that way too. And watch these wheels like slowly turn of like, okay, we have more in common than I thought we had. It's my favorite week like of my entire job because watching them make those connections with each other is
Hmm.
just so profound. It doesn't always have to be with us. It can be with other kids that have a similar lived experience, even if it's not the exact same.
Oh my, amen. Oh my gosh.
Coolest. Yeah.
Powerful. I love that when you talk about them making that connection. I want to share, Julie shared with us,
Yeah.
Julie, with a reminder to make sure that when we are writing those goals, especially those self-advocacy goals, that we need to be sure that we're sharing those with the classroom teachers so that they can also be supporting it, maybe co-implementing that goal. And that we help monitor. We also need to be monitoring the classroom throughout the year.
Yeah.
So as the classroom changes, oh, this is so important. If seating assignments change, we can make sure that the child is getting those accommodations for
Hmm.
preferential seating. Make sure that our students are facing the teacher. Oh, she says, make sure they're not next to the air conditioner. Some of the things that we might not
Yeah.
automatically think about, but how impactful that is for a student to be with that ambient noise.
Yeah. Yeah.
Thank you, Julie.
Air conditioners, fish tanks is a popular one,
Mm.
pencil sharpeners, the door to the hallway. I mean, yeah, it's the other thing too about communicating with the teacher is sometimes, especially like in my current setting, I'm in an outpatient setting.
Mhm.
And so we can kind of orchestrate communication breakdowns and then give them the opportunity to repair them. But it's a pretty comfortable setting. And I always tell students this, like, it's really great if they can do that here. But if they don't do that in the settings that actually mean the most to them, then what's it doing? Probably not much. But again,
Mhm.
if you can connect with the teacher and say like, "Hey, this is something we're working on. Can you look for opportunities where they either are or aren't doing this so that we can see like, is it generalizing? Because if it's not, you know,
I'm hearing another collaboration between
yeah.
the school SLP and if the student is getting outpatient, making
Oh
sure that
yeah.
that connection there, I think that would be
Yes.
huge.
Yes, getting access to their school goals is monumentally impactful for us as outpatient clinicians because if we're working on completely different things, it's it's going to take probably twice as long for us
Mhm.
to see that same level of growth versus if we're on the same page and they're working on it in different settings, that's just going to maximize that generalization for sure. I love getting to log on to like the kids I work with IEP meetings and get to hear kind of what's going on at school because again, that's the stuff that matters. If they can do it
Absolutely.
one-on-one in a therapy room, it's great. But if it doesn't go anywhere else, we're
Yeah,
not
well,
really.
that leads me into my thought because you're working with students, you said 7 to 17. So you're working
Um,
with, oh,
just
sorry.
for that one camp.
Oh, okay.
Yeah, yeah. So
But
my
you're working,
youngest right now is about 22 months. And then again, I have some 80-year-olds. So
oh,
way up.
wow. Okay. You
Yeah.
are, yeah, you're the entire lifespan.
Way
I
up
love it.
there.
But when you are working with those adolescents and that you
Yeah.
see that maybe the families have indicated that they aren't on it, they aren't supported by special ed, meaning that they don't have an IEP.
Yeah.
What are you recommending for families in that case?
A lot of families don't really know that 504 plans are an option. And
Oh.
obviously, there's different, qualifying factors in different states, and that's going to vary from state to state.
Mm-hmm.
But sometimes, as material gets denser, as the cognitive load increases, kids who, at the last time they were evaluated for speech and language looked like they were doing okay. But as that kind of cognitive fatigue
Mhm.
picks up, especially for our kids who are deaf and hard of hearing, we might see some gradual decline. And the last thing we want is for it to get to a point where that decline or the fact that they're falling behind is like bolded in red, because then we've got this big gap, right? But if we
Mhm.
can get kids on 504 plans where we're checking in and we're just really making sure that they're developing at a positive trajectory, it just gives a little bit more of peace of mind. And I found that it really helps parents feel better too, because it's exciting when you hear like, okay, they're going to get released from speech services. A lot of parents are like, that's so exciting, they've done so well, but what if?
I'm thinking about what about those accommodations, especially the ones that Julie was
Yeah.
saying
Yeah.
about making sure that they have seating consideration, full stop,
Yeah.
making sure that the accommodations are still in place for them for education access.
Mm,
Because
yeah. And that's
if
a
they're not
big
facing,
part of the 504 plan is all of those things can be really specifically outlined. And as kids get older too, I think it's so important to like counsel with them about like, what do accommodations mean to you?
Mhm,
Because a lot of the times teachers hear like, okay, preferential seating, and that means like front row, front and center. But classrooms are more dynamic now. Teachers
mhm,
move around, they use different resources. So preferential seating might not mean front and center. So
right,
asking the kids, like, hey, when do you do the best? It seems so simple, but like, do teachers use captioning when they show videos so that kids
yeah.
can hear them appropriately and use that support? Again, it's one of those things of like, of course, but it's easy to forget to do those things. Checking in for comprehension, making sure that kids are given the processing time that they need and not like, oh, you didn't answer right away, so I'm going to move to the next person, or I'm going to repeat the question right away. Because again, that auditory processing load is there.
Mhm,
Sometimes that listening fatigue is starting to set in. Then we have language formulation. And then if the teacher represents the question, sometimes their stress level jumps then. I mean, it's a lot to manage all at one time. We have this idea of like, oh, kids are so lucky. They just go to school and they learn. But it's hard. They're working really hard, especially our kids who are deaf and hard of hearing, because the listening fatigue element is very real and very evident across grade levels from the time they walk into preschool up through college. It's tough. Yeah, those accommodations are huge. And again, the more we can help kids identify what accommodations mean for them, the more likely they are to, I mean, thinking really long term, seek those out at the college level. Because to get accommodations at the college level, students need to seek those out. It's not something that's going to be granted without them exploring that. And I think, again, the more they understand what helps them, the more likely they are to use those further and further down the line.
hey, we have a question,
Yeah,
um, about a young, early 2.2 and a half-year-old-ish,
sure.
trying to get somebody that young
Mhm.
on board wearing hearing aids outside of maybe daycare, or so, if the child's saying, "Oh, it's too loud," or maybe they
Mhm.
refuse to wear them. What are some suggestions for a little one?
Sure. First step for me when kids seem to have any level of discomfort with devices is always going to be a referral to go see their audiologist. I think that we often think like, okay, well, loud is perceptual, and maybe they don't fully understand that concept at 2.5, which is totally possible, but it's also possible that they're not fit appropriately. And if children develop this connotation with like, okay, the hearing aids mean the sound is loud and that either scares me or potentially hurts me, of
Mhm.
course they're not going to want to wear those. And once they establish that negative correlation between the device and discomfort or fear or whatever the case might be, it's going to be a heck of a journey to get them back on a good page. So if there is discomfort, that would be a really quick and easy step. Like most things with kids, I think that kids present differently in different environments. I can't tell
Mm,
you how often I've, talked to a family and I'm like, oh, they're doing so well and they're so kind to their classmates, and parents are like, my child, my child is doing that, because at home they're brutal to their siblings, right?
yeah.
But kids have different expectations set for them in different environments, and oftentimes home is where they are the most comfortable, and in turn, sometimes that's where they kind of push back on expectations the most. And so it's important to not compare between environments, because every kid's going to be a little different at daycare, at home, at school, whatever the case might be. But really helping parents set up kind of like dosages that they feel like they as a family can manage. So those
Mm,
birth to three cases, it's so important to see them holistically, because we're not necessarily, we're working with the child, but more than that, we're trying to equip the parents with the skills that they need to help support the child at home. And so a big piece of that is incremental dosage of like, okay, if you have access to any of their data related to device use or data logging, which you could probably get from their audiologist if you're in touch with them, if they're at, let's say, 2.5 hours per day. Okay, the next time that we see you, I want you just to work toward 3.5 hours per day. And it sounds kind of silly and a little trivial potentially, but sometimes with parents, we sit down and we make a schedule and we make a chart, and sometimes it's a sticker chart that the kid, completes and gets to mark off. And sometimes it's just something that parents track themselves. But I think the important thing that we really want to avoid is expecting parents and families to go from 2.5 hours of average use to 12 hours of average use, because that is a really big gap. The other thing to think about would be discussing that with the child's audiologist and thinking about some kind of accessories for their hearing aids that might be helpful. So, retention devices and things like that, because, of course, the last thing we want are kids removing devices and having them be kind of free flying,
mm.
because that obviously creates a whole nother challenge. So, I would say in short, and it's a much more complex, the most appropriate answer to this question would be much more complex than this, and would really involve like, what's their hearing loss look like? What types of devices are they wearing? How much time is spent at home? Who are they spending most of their time with? What's their communication modality? I mean, we would have to do like a full background,
Mhm.
but really, just like incremental dosages is kind of the simplest answer that I would have to try to help them support that device use. And, telling parents it's going to be hard. Changing schedules and changing expectations and helping kids know and understand new routines, especially in the environment at home that's supposed to be their like safest space,
Yeah.
is brutal. And it's going to involve probably weeks where it's really, really hard. And then one day they're going to go to bed that night and be like, oh my gosh, he wore the hearing aids all day minus nap time and bedtime, and it's all gonna feel worth it, but those first few weeks are tough,
Yeah.
tough.
I like that looking at the dosage you said. That's interesting. I mean, we all need to take a break,
Yeah,
right?
yeah.
Maybe to tune things out.
Sure. Yeah. And I mean, there are plenty of kids, like even, our middle school, high school, where parents are like, oh, yeah, he comes from home from school and takes both his hearing aids out and just goes into his room for half an hour by himself. And again, that listening fatigue is tough. And it
Mhm.
starts from a really young age. And it might not be listening fatigue at that point. It might just be kind of orientation and getting used to what it sounds like with their hearing aids, but it's still challenging. And again, they don't know the why behind it. And at 2.5, it's very difficult to reason with a 2.5-year-old.
Yeah. And I think, yeah, our person asking the question gave us a little bit more. She also said the dosing. So obviously that is really an important part, and allowing to break time during the day. I like that, right? I think, we're getting towards the end of our time, but could we talk a little bit about that social emotional
Yeah.
component before we go? Because I think that's huge with our children with hearing loss.
Yeah. One of the really interesting things for me is always when I talk about what I do with people and I tell them, like, oh, I'm a speech therapist. And then they ask, kind of, oh, do you work in a school? And I talk a little bit about the population. And I typically say, like, I work with children who are deaf and hard of hearing. And the first reaction I always get is like, oh, those poor kids. And it's kind of like, well, actually, if you ask most of them, they think they're pretty great and like they're doing pretty well. And I think a big piece of that comes from, again, that connection and autonomy over their devices and understanding that kind of the why behind it. But I also think that it's encouraging and celebrating what makes them different, like we talked about a little bit.
Mhm.
And, doing our best. I would love to wrap every kid I work with in bubble wrap and protect them from
Yeah,
the
of course.
universe and having anyone step on their self-esteem. But
Mhm.
that's just not how the world works. But when we can instill and celebrate the things that make them different and help them begin to believe that, that's a really big step, right?
Mhm.
So, it's as simple as being like, oh my gosh, you got new ear molds. Those are phenomenal. I love them so much. Can I take a picture of those? Like, obviously, we can't keep their face in it, but, just really kind of hyping them up, for lack of a better word, about what's cool and different about them. The really interesting thing that has been found in research, like I said, Dr. Walker does a lot of research about kind of social emotional and trying to get a pulse on what these kids feel about themselves.
Mhm.
Most of the kids feel really positively about themselves and their hearing loss, at least on the surface level. They
Mhm.
love their hearing aids. They know that it helps them. They know that it makes it better. And I will say that this population is pretty heavily skewed in terms of like SES and maternal education. So we always have to kind of factor that in, where they come from higher SES families and, level of maternal education is higher. But I think that those kids kind of go to show like what outcomes can look like. And, not every kid comes from a home where they have that level of
Yeah.
celebration. And so I think that it's a heavy burden sometimes to bear as a provider, but I think that that kind of means that we have to give that to them somewhere else. And we never know, everything that's going on at home, of course, but I think again, it's really finding those opportunities to celebrate what makes them different and to say like, how cool is that? I try to find like similar things and parallels, right? Of like, I wear glasses sometimes, they help me see, your hearing aids help you hear. But I also think it's a delicate balance because I never want to minimize their experience because as kids get older, they're like, yeah, well, a million people wear glasses, but I'm the
Mhm.
only kid in this whole school that wears hearing aids, right? And they can figure that out. I don't feel like I'm answering your question very clearly,
No,
but I think it's
actually, you're
really
kind of
just,
wrapping it
yeah.
all up, the I think it's interesting the comparison that you make with the hearing aids, the deaf and hard of hearing with the stuttering. I've talked with I've had episodes on stuttering as well, and the importance of accepting
Yeah,
acceptance.
yeah.
And the one thing we all know, we are all different. And different is good. And I liked when you said don't minimize, because I think, we might say, oh, everyone stutters. No, no,
Yeah,
no,
they
no,
don't. Yeah.
that's a lie.
Mhm.
And then saying, but making that comparison that some of us do need devices to help us do different things.
Yeah.
And I think
Yeah.
is that's where you're kind of bringing us back around
Yeah.
is the why it is okay.
Yeah.
Because it could be a lifelong. It's a lifelong,
Mm-hmm.
right?
Yeah. And that acceptance isn't linear. We wish it
No.
was, right? We wish
Oh,
like
yeah.
one day they turn the page and they're like, "Oh, now I love my hearing aids." And I think sometimes too it's giving them the space to be like, "Yeah, that's annoying. Your brother
Yes.
doesn't have to wear hearing aids and you do. That's
Not
annoying."
fair. It's
Yeah,
not
that's
fair. You're right.
totally.
Not fair.
Yeah. Yeah, which I think is true for just about every single diagnosis and kid who needs speech
Agreed.
therapy for literally anything. Yeah.
It is. Oh my goodness. I can't believe
I
this
know
hour.
that was so fast.
I know. I know. I know. Oh my gosh. Thank you so much, Meaghan. This has been amazing. And I hope that you'd be willing to come on again. I know.
Oh, I'd love to.
Oh,
Yeah,
I'd love it. You
yeah,
just have such a passion that we can feel.
thanks.
And that's what we want. That's what we need as especially as we're starting our new school year. We want that. We want that
Yeah,
passion. So we're just so thankful to have you. Thank you so much. This has been amazing, and I can't wait to get you back on again.
yeah. Thank you guys for coming and thanks for having me.
Yep. Thank you. Bye, everyone. Bye. Thank you.
Bye,
Thank you. Thank
everyone. Thank
you.
you.
Thanks for joining us on today's podcast. Remember to go to speechtherapypd.com to learn more about earning ASHA CEUs. We appreciate your positive reviews and support and would love for you to write a quick review and subscribe. If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete address in your account profile prior to the course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to be reflected on your ASHA transcript. For our School of Speech listeners, we have a special coupon code to receive $20 off any annual subscription to speechtherapypd.com. Head over there to get ASHA CEUs for listening to this podcast and all other episodes. The code is SCHOOL20. That is SCHOOL20. Hope to see you on our next episode. Also, please don't hesitate to tell us which topics you would like us to cover in future episodes. To get in touch, drop us a line in the comment section or send us a message on social media.